Hi everyone, this is Jen Woodhouse and Jacob Boyle. We are both nurses in the Mount Mercy University MSN program on the nurse admin track. Today we have chosen to focus our presentation on the respiratory system and more specifically asthma. We chose to focus on asthma because it's a common respiratory disorder that's very treatable, and most likely we will encounter this quite a bit throughout our nursing careers. And fun fact, did you know that May is actually Asthma and Allergy Awareness Month? So the timing of our presentation is perfect in relation to this awareness month. So before we begin, I want you to pause for just a moment. Take a look at the beautiful scenery in this picture. Now take a really deep breath in and out. The act of breathing seems so simple, yet there are so many things happening in a fraction of a second. And many of us take for granted this simple act of taking a good deep breath in and out. So now think for a minute if you have asthma and how difficult that is sometimes to really get that good deep breath in and out. So we're going to dive a little bit more deeply into why that is. By the end of our presentation, we hope that you will have a better understanding of the key anatomy and function of the respiratory system, identify abnormal lung sounds associated with asthma, be able to describe the physical assessment related to asthma, recognize signs and symptoms associated with asthma, gain an understanding of the pharmacological and non-pharmacological treatments for asthma, and describe the patient teaching needed for better control. People generally think of breathing when they think about the respiratory system, but breathing is only one of the activities of the respiratory system. The body's cells need a continuous supply of oxygen for the metabolic processes that are necessary to maintain life. The respiratory system works in conjunction with the circulatory system to provide this oxygen and remove waste products of metabolism. It also helps regulate the pH of the blood. The respiratory system allows you to talk and to smell, brings air to body temperature, moisturizes it to the humidity level that your body needs. And the respiratory system also protects your airways from harmful substances and irritants.
The organs of the respiratory system include the nose, mouth, throat, voice box, windpipe, large airways, small airways, and the lungs. And we'll get more in depth with each of these as we go on through this presentation. In the upper respiratory system, we have the nasal cavity, which is a main source of airflow in and out as we breathe. And then we have the pharynx, which is what really connects the nasal and the oral cavities. And then that leads down to the larynx, which is mainly in our voice box. So anytime that we yell, scream, sing, anything like that, that is really stemming from our larynx. The upper respiratory tract is composed of the nose, nasal cavity, sinuses, larynx, and trachea. All of these work together to make sure that we are able to properly humidify air that we breathe in and also stop any foreign substances or pollens, things like that could come in and get into our lungs and cause any type of infection. So whenever we have a patient who has asthma, depending on what is going on with their sinuses, this can definitely cause more triggers in asthma if they usually have a reaction to any kind of pollen or any other environmental things, or even things such as smoke. So right below the larynx we have the trachea. This is about usually 4 inches long or so that travels down into the bronchi, which goes into each of the lungs. So typically if somebody were to have like a bronchoscopy, then we would take essentially like a little camera and run that through the mouth and then down through the trachea and see into each of those bronchi in the lungs, or if we ever needed to do a x-ray to see if anybody was having like trachea deviation, this is really what we're looking for. In some patients that we see, some potentially could need a tracheostomy. A lot of the times people who are on a ventilator for a week to usually more so 2 weeks or longer they tend to actually need a tracheostomy to help them to be able to breathe long term. We also see this type of situation in other patients who might have more of a superior kind of neck cancer, throat cancer, anything like that that would prevent any kind of obstructions with breathing. And also we see this in people who might be in an accident, who have any kind of a blockage and need immediate airflow. Then we can make them an emergency tracheostomy if needed. For the lower respiratory tract, we have the lungs, the bronchi and bronchioles, and the alveoli. The lungs are our essential organs for the respiratory system. Our left lung has 2 lobes, while our right lung has 3 lobes. Air travels down through the bronchi, through the bronchioles, and then to the alveoli, which causes gas exchange, which we'll get into further. Air comes from the trachea down first into the bronchi before it travels in through the bronchioles of the lungs. If we were ever doing like a bronch, this is exactly where we would first travel through to be able to see into each individual lung. The bronchioles are smaller branches off of each bronchi that lead through the lungs and then have tiny alveoli sacs attached at the ends of them. This is where we can definitely see problems with our asthma patients if they have a narrowing of the bronchioles, which can then really impact a narrowing of airflow to and from the alveoli. The alveoli are tiny, small sacs at the ends of the capillaries. Each lung has roughly 300 million alveoli through them. Whenever these sacs are collapsed, this can cause a major problem with breathing simply because this is where gas exchange occurs at. So a typical one that I usually think of is anytime that we see a patient who smokes. A lot of that tar buildup can cause the alveoli themselves to collapse, which then really starts to impair oxygenation for that patient. In this diagram, we have gas exchange. So here we have whenever we are breathing in oxygen-poor blood. This travels through the right atrium, down through the right ventricle, through the pulmonary artery, and then in through the lungs, which then the gas exchange occurs in the capillaries there, and then as we're breathing out, that blood then travels through the pulmonary vein, through the left atrium and left ventricle, and then we breathe out. So this diagram is explaining the mechanics of breathing. So as we breathe in, the diaphragm moves down to allow extra air to take in the lungs so that way they can expand. Then once we breathe out, the diaphragm then pushes back up again to help the lungs expel all this air that they have through them. So sometimes when we're breathing in, we notice that the abdomen is expanding, and that's because the diaphragm is also pushing down to help give the lungs more space, essentially. So whenever we see a patient who is having accessory use of those muscles there, that really makes us question, why exactly is that happening? They must be breathing awfully heavy if they're needing to be using that much more muscle, and thus we can further investigate how we can help them. So this is a really good diagram that helps us understand some of our respiratory sounds a little bit better. So at first there we see the crackles, and this is usually more typical of like pneumonia bronchitis. So it kind of just sounds more almost like Rice Krispies kind of if you're listening to them. Then when we have wheezing, that one is more like a musical sound, and that's very common whenever we have an asthma, COPD kind of patient. And then lastly we have rhonchi, and that's like a really loud, harsh snoring noise, and that's when we have more secretions in the larger airways like the bronchi. Although there are many respiratory diseases, some of the main ones include asthma, sinusitis, COPD, emphysema, chronic bronchitis, lung cancer, pneumonia, and of course, as we're all familiar with now, COVID-19. So now that we've kind of got the gist down about the respiratory tract between the upper and lower, and then different types of respiratory diseases, Jen and I are really going to be focusing on asthma. So asthma is a chronic breathing condition that makes it difficult for people to breathe. This affects everybody differently. For some people, it can be a pretty minor condition, and other people, it can be definitely much more severe. So this happens because there's an allergic reaction of some type usually. Otherwise, sometimes it can be more like exercise induced. And then this is basically causing a narrowing of the bronchi, which makes it difficult for people to breathe. So this causes those patients with asthma to start coughing, wheezing, anything like that, because of the fact that the narrowing in that airway is causing so much more trouble for that person trying to breathe.
So why are respiratory diseases so important? Well, according to Healthy People 2020, currently more than 25 million people in the United States have asthma. That's 1 in 13 people. The burden of respiratory diseases affects everyone. It affects individuals and their families, our schools, our workplaces, neighborhoods, cities, states. Because of the cost to the healthcare system, that burden of respiratory diseases just in general falls on society because it's paid for with tax dollars, with higher health insurance rates, and with lost work productivity. The annual healthcare expenditures for asthma alone are estimated to be at $20.7 billion. Some common risk factors associated with asthma include having a parent that had asthma, being sensitive to irritants and allergens, having respiratory infections during childhood, and being overweight. The environment that we live and work in also can contribute to the development or our risk for asthma. Certain populations have higher risk factors as well. These include children, women, and boys, African Americans, Puerto Ricans. Our socioeconomic status affects whether or not we are more at risk for asthma. And certain work exposures in the workplace.
So this is a really good diagram depicting different types of things that can cause people to have asthma triggers. So a huge one for a lot of people is definitely cigarette smoke. Other things might include pets, pollen, different types of insects or bugs, any kind of perfumes or colognes, and then a lot of times, especially in younger people, it seems to be more exercise induced. Also, definitely changes in the weather. So if somebody's extremely cold or very hot, that can cause an asthma trigger as well. Some different symptoms of asthma include some chest tightness or pain, any kind of excess pressure that somebody might have, coughing, shortness of breath, and wheezing. So a really good way for myself to envision this is I think of people who are athletes who might have asthma. So once they're, especially like track athletes, once they're done running a race and they might be really, really short of breath, wheezing, coughing, anything like that, usually it's because of asthma. So once we can get them their medication that they need to really help open up that airway, that seems to really help. And granted, there are also many things that this can cause asthma to flare up, but that's a pretty typical one to help people try to think of it better. So this is really just a diagram that Jen and I wanted to include in here to help people really understand how exactly the progression of asthma works. So once somebody is diagnosed with asthma, they really start to assess the severity of it. So like I stated earlier, some people really have mild cases of asthma while other people have much more severe. So really defining that severity is definitely a very crucial part in treating their asthma. Next is initiating medication and demonstrating the use of that. So people will use it for PRN, other people use it as scheduled medications depending on the severity, and then us as healthcare professionals really demonstrating that to make sure that there's always an understanding. And then developing an asthma action plan. So if it is somebody who it is just kind of a flare up here and there, really trying to help the patient understand how exactly we can work with them to treat that appropriately. And then for other people who it is more severe, making sure that they understand when to take their medications as scheduled to help prevent any kind of a flare-up, and then scheduling a follow-up appointment. So we want to make sure that there isn't really much changes in the bronchi or in the lungs in general with these patients, and to see how this treatment's working. If the treatment is not being very successful, we want to try going down a different course to make sure that we are giving the patient the best possible outcome. So as mentioned before in the last slide, this is just one of those action plans that somebody could use with a patient to help them get a better idea of how they could exactly be treating their asthma. So making sure that somebody's in the green zone, yellow zone, or red zone. So of course anything red is very, very bad, and that's essentially a medical emergency. So this is a great idea to help give your patients a better idea of how they can stay on track, and then what they should be doing if something should happen in the event of having any type of asthma attack. So anytime that we have a patient who does have asthma, they can come in and we can do a variety of different tests, depending on if it's we're trying to diagnose in general or to assess to see how well the disease process has either increased or decreased throughout time. So one is a pulmonary function test, which really is essentially just testing how well of a lung capacity that they do have. Another one is a chest x-ray. This really helps us see if there is any type of like pneumonia or any other kind of foreign substances that could be in the lungs. We could be doing blood gases, sputum tests, skin tests, or an IgE. That IgE is actually an immunoglobulin test, which is more so to test for any kind of allergic diseases that somebody might have. This is a diagram that really helps us see lung volumes and capacities and helps us understand better how well somebody's lung function is. So over on the left-hand side there, we have the different individual volumes. So the inspiratory reserve volume, the tidal volume, expiratory reserve volume, and the residual volume. So then when we're looking at the different color codes, we can see approximately how many liters of that they can hold individually. Then on the right-hand side is looking more so at capacity. So these are if we're adding certain ones together. So if you look at the different color codes, like for example, the inspiratory capacity is actually the inspiratory reserve volume as well as the tidal volume put together. So roughly that should be about 3 liters. So we want to be able to see how much air somebody can hold at that time. So of course with all of our patients, we want to try to do anything non-pharmacological as possible first before we go to any type of medications. So the first thing for asthma patients to do is really avoid any allergens. So if you're allergic to dust, don't be cleaning in very dusty areas. Any type of safeguarding that you can do at your house. So changing your furnace filters, having air purifiers, hypoallergenic bedding, things like that. A big thing especially is I've met multiple people in my own life personally who it might be a couple who one does not have asthma and the other one does, but yet they still have like a cat or a dog that really can cause that to flare up. That can be a really, really big problem that I think people that don't have asthma don't fully comprehend. That is definitely a huge trigger for an asthma attack that we don't want to have somebody have to go through. Another big one is air pollutants in the environment. Usually in springtime, this can be a problem because the pollen count can be definitely a little bit more elevated. So really trying to avoid any pollutants like that is what's also going to help. And another big one is smoking. So if somebody who does have asthma lives with somebody else who smokes in the house, that is a huge, huge problem because that can really cause that asthma to flare up and be a huge trigger for them. So now for our pharmacological treatment, huge one for asthma is of course inhalers. So as I've mentioned a little bit earlier, some inhalers are more so PRNs and other ones are more scheduled. So making sure that we might have like a bronchodilator first to really help get that airway opened up, and then another one in there to help relax that smooth muscle in there that's causing that to flare up so bad. Another one could be vaccinations. So a huge one going on right now is COVID-19. Anybody who does have asthma and is a very high risk, if they would develop COVID-19. So really trying to prevent that by vaccinations is a great way. And then, of course, the Healthy People 2020 goal is really just making sure that there's good prevention, detection, and treatment, and educating our patients to make sure that they understand fully what's going on. Sometimes for healthcare professionals, asthma can be kind of second nature because there's so many people and patients that we've dealt with that do have this. But for the common patient, some of them really might not understand that, and as long as we keep that in mind and help educate them, then we can really help reduce any type of asthma attacks or emergencies. So now for the different types of asthma inhalers that we have the relievers and the preventers. So the relievers are more of like a bronchodilator, so this it can be more short acting. So a great example of this is if you do have like an athlete who was running a race and now all of a sudden they're feeling like they have a lot of tightness in their chest or they're really short of breath, you really want to give them a bronchodilator because that's going to help open up those bronchi back up to help them get more airflow in and out. And then you have the anti-inflammatories, which are more long-acting, which help more so prevent having like an asthma attack. So the big thing to remember is that you want to do a bronchodilator first, then the anti-inflammatory second, because if the bronchioles and the bronchi themselves are not opened up, then the anti-inflammatory is not going to be nearly as effective. So making sure that we get those opened up first, get that anti-inflammatory in there secondly, is what's really going to help that patient in the long run. Some inhalers are really more so just for rescue effect, so they're very short acting. They only work for about 3 or 4 hours. And these, like I just talked about, are more so your bronchodilators because they're really going to help open up that airway to make sure that we can get some better increased airflow into the lungs and out of the lungs. These medications are your controller meds, so these are more so used to prevent asthma. So these are more the anti-inflammatories. I know that Advair is a pretty common one that I see some people use. So these are ones that you definitely want to take on a daily basis to make sure that we're reducing the incidence of possibly having an asthma attack. So some people don't really fully understand the need of a spacer. So these are two really great pictures of without one and with one. So as you can see, they're more on the left hand side. Somebody is using one without a spacer. So most of that medication there is really just ending up in their mouth, and it's really not even getting down into their lungs because they're really not breathing that in properly. Whereas if you use a spacer, that really helps more so inhale that medication and gets into your lungs better to make it be a little bit more effective. So we really want to make sure that when it's needed that we are promoting the use of a spacer and making sure that we're educating patients so they understand the effectiveness of it, and if they have any questions to let us know so we can help explain that a little further.
Another fun fact for you, did you know about 189,000 people in Iowa have asthma? But the good news is with proper treatment, people with asthma can lead full and active lives. We hope our presentation was a good review for everyone of the key anatomy of the respiratory system and also the function of the respiratory system. Signs and symptoms of asthma can be pretty subtle, so a good thorough health history and physical exam are necessary to recognize and diagnose asthma. Asthma is a very treatable disease, but there is no cure. So helping patients recognize their triggers and a lot of patient education regarding staying away from triggers of asthma is very important because asthma is common and it can be deadly. So having a good action plan in place is a great plan for our patients. If anyone has any questions or comments, please feel free to email us. Thank you so much.